I've never felt anything since you did this, other
Right.
than, of course, when I was wiping my nose or something, I
Yeah.
would notice soreness there only a little bit
Yeah.
because everything's a little bit puffy.
Right.
But other than that, I think it was just truly amazing. I'm just amazed by it.
Yeah.
And I'm glad that you got to do that procedure on me.
Yeah, I am too.
I'm glad I didn't have good bone for you.
Yeah.
That's crazy. What do you
Well,
do?
She's a taping as we talk, and I'll show it to you. Let me ask you, because you told me this before. Tell me about how you felt about your teeth before you had this done, like toward the end there. Like
I was
the
ashamed
6 months
of my
before.
teeth. I was ashamed to smile or to have anybody notice me. And I wasn't eating well. I wasn't eating good at all.
Yeah.
I knew that I had to have this done, but I was too afraid. I was afraid of the. Can you imagine? All I could think of is, oh, it's going to be so painful. But I was just so shocked that I had no pain. I had no pain at all. I could not believe that. Now I am not afraid to come to the dentist for any reason.
Oh, good.
Now that I don't have any teeth.
Yeah. Now that we got fake ones to work with.
Right.
Yeah.
Feels good to me.
Yeah.
But anyway, I feel as though before I had it done, I actually had stuffy nose too, all the time. Like I always thought it was something else. Maybe it was just a combination of everything that was going on with me.
Infection.
I feel like there was some. It must have been that. When I got a lot of. It must have been a lot more than I was thinking it was.
Yeah.
But
Yeah. The teeth felt solid to you from pretty much from the first day.
Absolutely.
Yeah.
I never had any. I think when you go home, you're waiting for that pain. That's how I kept thinking. I know there's going to be pain with this, but there wasn't. And
Yeah.
no matter what you're told, you're going to think your mind's telling you, of course there's going to be pain. He put those pins in your bone.
Yeah.
That I still don't understand that. I don't.
I think it's because of the medications we use and stuff. That's part of it because it's just I used to tell people when I put implants in that it hurts more to have teeth taken out than it does to have the implants put in. But you had all that done at one time, and you still didn't have anything.
No,
so,
I didn't. I really didn't.
Yeah.
I had, I think when you're on, people are always afraid of the unknown, and I was afraid of that
Yeah.
from the very beginning. And I don't know why. I think we all want to have the control of ourselves.
Right.
Well, once I decided I was given this to you to
Yeah.
do, I
Yeah.
said, okay, I told you it was between God and you. That was it.
Yeah.
Look where I put you.
Good.
But I really felt like once I decided, I couldn't. I got to see those X-rays, and I could see that bone loss that you were talking about, and I'm going, oh, that's frightening.
Yeah.
That's very frightening. And then to think how diseased that really is. And
Yeah.
then I always got to thinking, what if you got cancer because you just decided. My teeth were that bad, I thought,
Yeah.
to that point,
And you remember when we had the consultation before, when I told you, you could have this done, but here was another alternative. We could take your teeth out. You remember when I showed you that denture, what it looked like? I mean, could you imagine right now?
No, I can't. I could not even do that.
Yeah.
I don't think I could. This is freedom.
Yeah. She would go to the nursing home and might lose her teeth if she goes to the nursing home. So they paid for this to have it done for her so that she would have fixed teeth in place,
Because she
Actually-
was having Alzheimer's,
Yeah.
and she lost her teeth.
Well, this mom Bob's mother actually would always do this type of thing, and it was just, and Mr. Johnson was just seemed so crazy. Oh, he couldn't believe she would do these things. But listen, I think to have this done, I got to thinking about it. Anybody that's going to have dental money into this and not have the dental work, the plates done,
Yeah.
because of this reason, really crazy about going in a care center, but if I have to be in one, no one's going to have to worry about that with me.
Right.
Nobody. Nobody's going to take my teeth and use them.
That's right. That's right. I won't end up in a pile, right? Now, here's another big factor for people is the cost, obviously. How did you feel about that? I mean, that was a hurdle to go through.
I was doing okay. We were doing great. Actually, when we first started talking about this, we were the financial situation was better because the stock market was better. When you lose half of your money in the stock market, but anyway, that's the. But financially, it's well worth it. Every penny you're going to do, and that's what I was talking to my husband about it afterwards, and I said, "Well, what do you think?" And he says, "It's not like we can't manage this. Why are you concerned about this? This can be done."
Yeah.
And I think if you plan, understand, know from the very beginning, you can manage it.
Mhm.
There's always some way to do something that's worth it.
Yeah.
I mean, you buy a new car. Why can't you afford teeth when you need it? And he says, "You can't go without teeth, Martha." And I go,
Right.
"Yes, I can. I just love you better. No teeth." Just, no. Would you go without teeth?
Yeah, yeah. He'd rather have you with teeth, right? Right. He'd rather have you with teeth, right?
I want, right. Oh, well, anyway, I think that financially, everyone can really afford it if they sit down and talk about it truthfully and figure it out for themselves.
Yeah.
If I were younger and I really needed this done, I probably would have went to work to just do that. I would have made money to do this because it's worth every penny of it.
Yeah. Yeah.
And actually, it's not as expensive as it could be.
Yeah.
I don't think.
There's certainly a lot of places I know that do it that charge a lot more.
A
than
lot
that,
more.
but, yeah.
And I've heard of other people having it done that cost years back. Not this procedure.
Yeah.
I'm not going to mention what this is called. I don't like the name.
Yeah.
Well, this procedure, gosh, it's worth its weight in gold. I mean, I really do believe it is. It's even, does anybody understand what this means? I have my teeth.
Oh,
I had surgery, I got up, went home, and I had
You
teeth.
had teeth. And they were way better than what you came in with. so.
Much.
Yeah, yeah.
I mean, I couldn't believe they were falling out so bad.
Yeah.
I kept thinking, well, maybe I could just push them back up, but I didn't know it was broken.
Yeah.
I didn't know that.
I didn't either until we got in there and found it. So yeah.
They're not good. But financially, I think it can be done by anybody. I really do think so.
Yeah. Well, that's a hard hurdle for people to get over because you think like, okay, I'm spending a lot of money. Is this going to be worth it to me?
Absolutely.
So that's the hard thing.
Absolutely.
So,
There's another thing I kept thinking. I know this is just so silly, but when we had Bob's parents living with us for 10 years, and she had developed dementia very badly. And we would come home sometimes, and she'd be sitting watching TV. One evening, I came home, and I looked down on the floor, and I said, "Bob, your mother's teeth are on the floor." Well, just think, Bob will never have to worry about that with me.
really,
Right? I will not have my
Yeah.
teeth in the floor. I will have them
that's
in
right.
my
They'll
mouth.
always be
When I'm
around,
90,
so.
I mean,
Yeah, you're right. You're right.
I think that's a good
It
idea.
is. It is.
See, that alone's worth it.
Yeah.
That's a good point.
That is a good point. Yeah.
It really is true.
Uh-huh.
Well, I have teeth in my head forever now,
Hmm.
even my bottom ones,
Yeah.
because
Well, we-
Barb's taking good care of those with me.
Well, we had a lady who was, she was an older woman and she had this done and she was, how old was she done? 88, maybe?
I don't know which one you're talking about.
Stella.
Oh, Stella, yeah.
She's
I was thinking of the
88,
lady we just
83.
did. Was the
Oh,
lady-
no, she was only in her 40s.
Yeah.
Well, we did a lady who was 83 because
No.
I think she's 83, 88, something
Yeah.
like that.
Hmm.
But
Yeah,
her,
but
fa-
to
her
me,
family was,
Forget the plate.
yeah.
Because eventually we are going to have this happen to us in our.
Yeah. Well, and the interesting thing too is you mentioned about when we talked about how much pressure you could put on a denture compared to your teeth. You know, you and I are the same age, so we're at a point in life where a lot of our enjoyment was going out to eat and having nice dinners and things like
Right.
that. And if you can only bite 1/10 with the pressure that you can with your natural teeth, that's not enjoyable eating. You know, there's a lot of things you can't eat. And, you know, so.
So we go out we go play golf and go with friends to lunch, late lunch, and they want to go to these places like over to the Pomeroy in the garden there and have lunch, and oh God, I have to be so selective of what I'm going to eat, you know, because I couldn't chew it properly. I couldn't, and then I didn't, and actually got to the point where I didn't really want to go any place to eat.
Yeah.
and I was cutting up my food so small and placing it in my mouth and thinking, I really need to get this worked.
Yeah, when you get to
Oh
that.
my God, you're eating a lot of food when you eat a hamburger. You really are,
That's
or any
funny.
food at
Yeah,
all.
yeah.
If you cut it up, you realize that.
Yeah.
And I was doing that, and I think I was going any place because I didn't want to go out to eat. And now I'm happy. I do what I want to do. I feel free. It's a sense of freedom, like I said
Yeah.
before, and I didn't have that for a while.
Right, right.
Really.
Good.
And then going to bed at night is a lot better too because I think I was, they must have bacteria or something because it was causing me to have stuffiness all the time and waking up, I would wake up about 6 times and that was not apnea, I don't think it was. I think it was just because I was, things weren't right.
Yeah,
I don't know.
Right.
Maybe.
That's
Right.
better now.
I agree.
I sleep like a log now, and I don't know. And I'm thinking to myself, ever since I had that anesthetic, I want to do is sleep.
Maybe it's still
It's
lasting.
a good stuff. I was keeping down because I didn't want anybody to see that my teeth. I had friends say, "Well, Marty, there's nothing wrong with your teeth. You have beautiful teeth." They didn't know what my teeth were like. They only saw what they wanted to see.
Right.
I did have, I had the bridge you made for me was beautiful.
Yeah.
That is a very good piece of work.
Right.
And I guess they just figured that, but it's the people don't know about that bothers
Right.
you.
Right.
When I noticed the bone and I saw that bone, it was scary.
Yeah. Yeah. It does get scary because
I didn't like that at all.
And even if you have the teeth taken out and you have a denture or something made, then you're going to still continue losing that bone.
That's
you know.
what's wonderful about this. You said it would stop.
Yeah.
And I think when I really got to see and thought, and I looked and I said to myself, now you're saying I can't have this done? Because you were really continuing to have that other procedure.
Right. Yeah.
But I thought, oh my. Then that's when I cannot believe that my bone was that bad.
Yeah. Yeah.
You were telling me,
Well, it's good now.
but I didn't believe you.
Yeah. Yeah.
I did believe you. I guess I was.
Yeah.
But I think it's nice to have beautiful teeth, a nice smile.
It is.
You
Yeah.
know,
They
Feel
look
good.
They look
I
good.
feel good.